Can a weight loss injection make you feel like you have flu? Before we dive in, a quick note. This video provides general information for adults in the UK and isn't a substitute for medical advice. Always speak to your GP or pharmacist for personalised guidance about your own treatment. Some people may experience tiredness, headaches, or feel generally unwell when starting Wegovy, though true flu-like illness isn't a typical side effect of the medication. If you're starting Wegovy and wondering whether it might make you feel a bit under the weather, you're not alone. This is a question we hear quite often. Let's talk about what actually happens when you begin treatment. Whilst flu-like symptoms aren't listed as typical, some people do report feeling tired, having headaches, or just feeling generally run down during the first few weeks. The good news is these sensations are usually temporary and tend to improve as your body adjusts to the medication. Here's what's important to understand. Wegovy is a GLP-1 receptor agonist, and the most common side effects are actually gastrointestinal. Things like nausea, vomiting, diarrhea, or constipation. These happen because the medication slows down how quickly your stomach empties. When you combine these digestive effects with fatigue and headaches, which are also recognized side effects, it can sometimes feel a bit like you're coming down with something. Now, cold-like symptoms, what's called nasopharyngitis, are reported with Wegovy. But it's worth noting that Wegovy doesn't suppress your immune system or make you more prone to infections. What you're experiencing is more likely your body adapting to the treatment, especially if you've recently changed your dose or your eating patterns have shifted. So how can you tell if what you're feeling is related to Wegovy or if you've actually caught the flu? This is really important. Fever and chills are not typical side effects of Wegovy. If you develop a fever, that's a sign you should contact your doctor, as it may point to another cause entirely. Similarly, if you have symptoms that are severe, persistent, or getting worse rather than better, don't wait it out. Speak to a healthcare professional. If you are experiencing mild tiredness or headaches in those early weeks, there are some practical things that may help. Staying well hydrated is really important. Dehydration can make you feel much worse and can intensify headaches. Make sure you're getting adequate rest whilst your body is adjusting. Try to maintain a balanced diet, even if your appetite has changed. And if you feel able, gentle physical activity like a short walk can sometimes help with feelings of fatigue. That said, don't change, pause, or stop your treatment without speaking to your prescriber. If you're worried about symptoms, contact your GP or pharmacist for advice. Let's be clear about when you need to seek medical advice. If you develop a fever, that's a red flag. If you can't keep fluids down, feel very unwell, or your symptoms aren't improving after the first few weeks, contact your GP. And if you're ever unsure whether what you're experiencing is normal, it's always better to check. Your healthcare provider can help determine whether your symptoms are related to Wegovy, whether you need additional support, or whether something else might be going on. Remember, everyone responds to medication differently. The type and severity of side effects can vary quite a bit from person to person. So to recap, Wegovy doesn't typically cause flu-like illness, but some tiredness and headaches are possible, especially early on. These usually settle as your body adjusts. If you develop a fever or symptoms that concern you, contact your doctor. And always speak to a healthcare professional for personalized advice about your treatment. Have you experienced any side effects when starting a new medication? Share your experience in the comments below. And if you found this helpful, please give it a like and subscribe for more trusted health information.